We are meeting today once again at the Meeting of Minds conference in Amsterdam, and right now we are hosting Dr. Adam Kasparek from England, and I wanted to ask him a few questions about how ADHD is perceived in England. Is it easy to get treated for ADHD? I will ask this question because I have quite a few patients from England, and they usually tell me it's not. I mean, it's not easy to get a diagnosis. Can you comment on that?
You
can hold it.
Oh, that's fine. With children, it was with child's pediatricians, it's still being managed, but the wait list now is about 2 to 3 years through the NHS. Sometimes it's regional, it can be quicker. And it wasn't really diagnosed as much for adults until recently. There's been some services that have opened up, and actually initially it got very more understood and recognized in society, so the demand went up at faster than the supply ended up coming up. So for a short period of time, it was very quick, about a few months, but then that quickly came into a few years, and there's not enough doctors that are specialized in order to kind of give those diagnoses in the US now. So quite often people end up going privately for those diagnoses.
Yeah, but they tell me that even privately it's not easy to get the diagnosis, and then it's quite, or should I say, even very costly.
It's varied. So I guess the point is there's no centralized way to find someone. So most people who are mainstream that you find on the website quickly, they will be booked up, and they will be for a long period of time. But you will find people who, if you have a friend who knows someone, then you can get it done a little bit faster. But quite often my experience is that if I run into someone and I tell them I won't be able to see them for 6 months or a year, they end up kind of going away and then coming back 6 months to a year later saying, but can you do it now? And I'm like, well, you had to tell me about that before. Yeah, but yeah, it's I'd say patchwork. It's still working a system to try to make sure that they get seen quickly. Yeah.
In Poland, we have a lot of problem with doctors, unfortunately doctors and sometimes psychologists, who first of all say that ADHD does not exist. Secondly, even if it does, they don't know how to treat ADHD. And thirdly, should I say, they don't believe in medication, or at least they think that stimulants are not the right way to get treated. Do you see such a problem in England? Does it happen that your patients tell you that they were not treated but consulted by a psychiatrist or a psychologist who said that do not get treated with stimulants because it will do you no good?
So I think there are a lot of, thoughts and myths that people have had in the past about stimulants, that they can be addictive and they can cause problems, and that there's worry about drug-seeking behavior. And I think that, like I said, it's kind of opened up in the UK in the last maybe 5-10 years, that there's much more knowledge about these experiences, and that's becoming less of a concern by people as a whole. But there still is concerns that psychiatry, most psychiatrists in the UK don't either feel comfortable starting, or might have personal reasons why they don't yet believe in ADHD, because they haven't been trained in their earlier years in ADHD. Because as we were talking, there's a conference here just recently where previously people were told that they didn't have ADHD after 16. They either just came back to normal, or they became antisocial, or were being challenging behaviors. But it's improved. It's improved a lot, so it's been accepted. But ADHD medication is still considered controlled, and that has a stigma associated that you need to be careful. And so GPs are very cautious about starting that medication. Psychiatrists still have caution about starting those medications. But the people who end up using it on day in, day out, actually, we feel very comfortable using this medication, and we feel like, Yeah.
Thank you for saying that. That's nice. Do GPs want to continue the medication when a psychiatrist starts it? And do you think they in England do you think they are uncomfortable with continuing the treatment? My patients usually tell me that GPs don't want to give stimulants or prescribe.
So, GPs generally want to make sure that a specialist is behind any medication that's being prescribed. And my personal experience whenever I see a patient is I tell them straight away, I say, before I start medication, talk to your GP first, make sure that they would be happy if a psychiatrist were to prescribe and start the medication. And actually that makes a big difference. Sometimes explaining my background as well, because the UK system, they have kind of a framework they need to follow to make sure that they're doing things properly, because GPs are worried that they might do things inappropriately. And so they have places that they have agreements to do shared care agreements with reputable doctors who they feel would do an appropriate assessment, because sometimes people do worry, there's still the worry that people might be getting a diagnosis and it might not be done thoroughly. So there are services that do the ADHD assessment. So I'm linked into one of those networks, and so I usually tell my client, please also tell them that I'm linked in with this service, which actually has been accepted by, throughout the country, a lot of different GPs. And if you let them know in advance, GPs will feel more comfortable instead of going to them and say, hey, I just saw a private doctor who gave me this, can you give this to me now, please? And kind of make the GP feel like they're being forced to do it without being involved in that discussion.
That's a good pointer, a very good pointer. And another thing is, so the treatment of ADHD should always involve at least some kind of psychotherapy. Do patients in England have this? Is it possible for them to get the psychotherapy? And is psychotherapy for ADHD, which is a bit different, available? How does it work?
I would say that's just kind of starting up. So I don't think it is a requirement in the UK to have psychotherapy with your stimulant medication. However, I do run into people that have a lot of challenges in their life where I don't think the stimulant is sufficient. Mm-hmm. Or for some reasons, there are some conditions where an ADHD stimulant isn't appropriate for a patient with ADHD. I have a few psychologists that I speak to who are now actually gaining that training so that they can have that ability to kind of provide that psychological support. And I always try to link in when I have an ADHD person to see if they would be willing to engage in that. But it's not a requirement as far as I'm aware at the moment in the UK.
Okay. In Poland, just so you know, the regulations say, at least in children, that a child is absolutely required to undergo the psychotherapy, which unfortunately is also, well, you could say, so both not treating the patient with psychotherapy or forcing the patient to undergo psychotherapy first is not very reasonable, but unfortunately this is another case in Poland. At least in children, in adults it's different, but in our clinic we practically require patients to go at least some kind of psychotherapy, depending on...
I'm an adult psychiatrist.
No, yeah, it's okay. I'm just telling you, just so you know, and so our viewers know what's the difference, for example, in England and in Poland. Do many patients, or this wave of new diagnoses, does it come up, and or has it already been up for some time in England? Because in Poland, we are in the middle of a wave of diagnoses, and we don't know how high it will go, but at least right now there are many patients, also thanks to the channel, who, well, you could say diagnose themselves, but then come for the proper diagnosis to a psychiatrist. What does it look like in England? Has it been up for some time, or maybe it's going down now?
So I guess you're talking about the total number in the UK. So that when I was going through my training, actually, and the focus in the UK was actually following not the DSM criteria, but the ICD-10 criteria, which is for hyperkinetic disorder. So actually, the diagnosis, the percentage would be a lower percentage than the ADHD, and people weren't diagnosing ADHD in the UK. There's, of course, a move now to where we're going to give diagnosis for ADHD. So there's going to be a probably 3 or 4-fold increase in the amount of people who would meet those criteria. And so those people wouldn't have been diagnosed before. But we probably do, by epidemiological data, know what percentage we would think of the population would meet the criteria for ADHD. Probably aren't there yet. I think there's a separate thing there, which is about whether we've diagnosed everybody and everybody who's come in. There are some people who do come in who I don't give a diagnosis of ADHD to, and I think that we have to be careful about people who give themselves the diagnosis. I think it's very healthy for them to get an appropriate assessment, and I usually tell in the beginning of my assessment as well, just to be very clear, I'm going to be asking you these questions. I need to get enough information from you to make sure that I'm confident that this is actually ADHD. And even if in that session I don't get that information, doesn't mean you don't have ADHD. It means that we just didn't get that evidence that day. But also, probably for 5-10% of my patients, as I'm asking questions, it becomes quite clear to me that there's something else that's going on as well. And then I have to ask them if I can go down that route. And actually, sometimes that actually is, I don't get enough for ADHD, but I do get enough for that other diagnosis. And then other times, of course, you have a lot of comorbidity with other mental disorders, which is another issue as well.
Thank you, doctor, for meeting us, and we will go and now listen to other lectures at the conference. Thank you.